Hi everyone, I'm Denise Merrick and you're watching Daytime. We've got another great show planned for you today. We'll be decorating for Christmas with Vandermeer Nursery. Urban Barn will be showing some great gift-giving ideas. The Living Room Community Art Studio joins us to talk about an adult coloring book. We'll also be discussing the upcoming Human Rights Forum. Fixopolis is here, and coffee culture to possibly make your wishes come true. To start the hour, Dr. Stephen Gallay joins us on shoulder injuries. Dr. Gallay, welcome to the show.
Good morning. Thanks so much for having me here.
So you are an orthopedic surgeon.
Yes,
and
I
specialize in shoulder injuries. How did you choose shoulder injuries as your specialty?
I guess I just fell in love with the shoulder at some point in time. But I studied whole upper limb as my specialty area after doing the orthopedic surgery training. And then I chose the shoulder. What
are you seeing in your field as the most common shoulder injuries?
So shoulder injuries probably, this area has about 1.5 million people. Every year about 2%, maybe 30,000 people just in our region will have a shoulder complaint. Most of them are rotator cuff related, let's say 75–80%. Then we have younger people who dislocate shoulders. Then we have arthritis conditions for the older patients. And frozen shoulder is another common entity, a pretty disabling, painful disorder. That sort of makes up the gamut of what shoulder conditions are that we see.
I heard about this frozen shoulder. What is that?
So frozen shoulder is something that comes on sometimes just by itself. We don't really know why. Even in 2015, we haven't figured out why. And it's extremely disabling. The shoulder becomes very painful day and night, burning, and the shoulder becomes very stiff. And unfortunately, this disorder can last 1 to 3 years. And it's just a huge amount of disability for the people, very, very difficult to live with. It's still a small segment of shoulder problems, but it's a very serious one.
Yeah, it sounds it. And in your field, you must get great reward for helping people. You have a shoulder program that you run. Tell us a little bit about the shoulder program.
So I'm glad you asked. I mean, that's obviously why we're here. But, you know, medical care, specialty care, which is what we do as shoulder specialists, we are in a specialty group. Unfortunately, up to now, a lot of our work has been done by ourselves. You know, you go to medical school, you train, and you take care of things more or less as a solo operator. We're trying to bring a team together. We've now, at Rouge, I was the first shoulder provider 18 years ago, and at Rouge we now are moving on to our 5th provider who can provide shoulder care. And rather than having everybody work by themselves, we've put together the team. And so we work together. And so we're trying to create more of a shoulder community of care. Rather than just physicians waiting to get their patients seen by one provider, we can provide more of a community, a group of care. And so that's really what we've done with our specialists.
Tell me about your team of specialists.
So we've created a shoulder program, and that's why we're here to talk about it. And we have the shoulder specialists, the surgeons, but then we also have other people that we're trained to be shoulder specialists. And they include a physician who's not a surgeon. We have an allied health, a physician assistant. At Rouge, we probably have the first physician assistant who is shoulder trained in the province, maybe even in Canada. It's a very uncommon allied profession. It's new to Canada. It's been in the U.S. for many years. And that physician assistant will work in our team closely with us to provide shoulder specialty care.
So there's a lot of help.
A lot of help.
And do you find that people are automatically referred to your program if they go to their doctor, or is it something a lot of people just don't know about?
So it's new, so people don't know about it, and that's why we're here. The traditional model is someone has shoulder pain, they go to their physician. Some will go to a physiotherapist first, but the physician is the gateway to the specialty referral. And the physician tries to refer patients on when they get to the point where they feel they haven't sorted out their problem. And up to now, a lot of the wait time is to wait to get to a specialist. So we want to increase the access by having a larger team, and a team that's just not made of a surgeon, but also our assistants or our team players. So the physician who's not the doctor, the allied health, the physician assistant, physiotherapist. So you have access to a larger group of people who are very knowledgeable on shoulder conditions. And I know it's just shoulder, but it really represents anything in medicine can be done this way, by creating a community of care and really working and linking right into the family physicians' practices. So they have real partnerships now. They're not sort of out there by themselves trying to figure it out. Now they have access to our center, to our program, and it is a community, really.
I love that community approach. And you are also saying that you have some new centers that are just starting up.
So the center, or let's put it, the focus of the hub of this program is called the Shoulder Center. Simple term, it's going to be housed at Rouge Ajax site in our main foyer. We have actually determined the site. It's going to be built and hopefully open for business maybe early January. And the shoulder center will be a focal point of shoulder activity. From the assessment part, the triage, the treatment. We'll have access to good technology, the ultrasound, the MRI in our hospital, and then of course some patients that go into shoulder care or shoulder surgical care. And so everything would be co-located, and at the same time we're also going to teach. So we'll have physicians come from the whole region who want to be shoulder experts in their local area and spend a little bit of time in our center. We'll train them to come back, sort of train the trainer. And then they'll go back to their area where they could actually help their group of physicians or physiotherapists know more about shoulder care. So really it's a dissemination of the knowledge and the update all along, so that if we learn something new, they learn something new immediately. They don't have to wait 2-3 years to go to a conference to hear it. And so that's really the shoulder program, the center, and the community of care.
Wow, that's so important.
In a mouthful.
So tell me, if someone is watching the show right now that is experiencing shoulder pain, what is the best way to get into your program?
I believe that we're providing the number, so there's an actual phone number, and as well, the key for the physicians who take care of these patients is to have access to us through a new referral process. So we have a referral form that we've designed that basically provides the physicians very key questions so that we know much more about that patient than we ever did before. So they're not just being referred with shoulder pain, they're being referred with much more information that we can actually collect through this referral process. So it's a form that they can actually hand to their physicians, but their physicians are also receiving these through fax or through the mail from us right now.
So with this team approach, people who come into the program, sometimes they might not require surgery in order to get healed from their injury. Is that correct?
Correct. In fact, you know, 90% of shoulder complaints don't need surgery. They just need a good diagnosis, an accurate diagnosis early to prevent a lot of unnecessary testing that unfortunately occurs the longer you wait to find out what's wrong with you. And as great as our physicians, our family physician group are, it's very difficult as technology and knowledge change so quickly for them to know everything about the shoulder, and they should have access to our community and to our group much earlier and quicker for their patients.
Great.
So patients stop waiting, get an accurate diagnosis.
Thank you so much for coming
Thanks.
today. It's been a pleasure interviewing you.
Thanks for having me.
Up next, the Living Room Community Art Studio. We'll be right back. Stay with us.